Welcome back. Testosterone is important for red blood cells, bone growth, and mood. And when the levels start to lower, men are generally treated with replacement therapy. According to a local doctor, it may be better to treat low testosterone levels by restoring the body's own production of the hormone. And he is here to tell us about his research. Dr. Parviz Kavusi is here from St. David's South to tell us about your research. So tell us what you've been working on.
You bet. So you're exactly right that testosterone is an important hormone for an awful lot of things. And traditionally, the way we've treated men with low testosterone, which there's about 13.1 million men that are diagnosed with low testosterone every year in the United States, is we've traditionally given them testosterone replacement, giving their body testosterone. The issue with that is in men that still want to have children and build their family. When we give a man testosterone replacement, it fools their body into thinking they made that testosterone. So all their signaling hormones telling their testicles to work think they're doing a good job, they tell them to shut down, and sperm production typically drops to zero or nearly zero. Because of that, there are other drugs that we can use to stimulate the cells to make more testosterone in a way that's safe for fertility and won't compromise that man's ability to have children. So the primary drug that we've used traditionally for that is just a pill. It's called clomiphene citrate, and it stimulates the cells to work harder. One of the potential side effects that we can see when we give men direct testosterone replacement is an increase of red blood cell production in the blood vessels called polycythemia to a level that's higher than normal. And when we see that, there can be associated risks with that. And although, we can see that with different levels of commonality depending on the modality of testosterone we're giving, that's the side effect that we tend to worry about and watch closely. There's never really been a good study looking at drugs like clomiphene citrate, the ones that are fertility preserving to increase testosterone, to see does it have a similar risk of increasing red blood cells in the blood vessels like direct testosterone replacement does. And that was our goal, to find out, does clomiphene citrate do that as well? So we had a two-arm study where we looked at men on testosterone replacement and men on clomiphene citrate, looked at their rises in testosterone, and looked at their red blood cell count increase, and we found that there was not a significant rise in red blood cells on clomiphene. So that's one more piece of safety data telling us that that's a good route to go for men that want to maintain fertility potential with low testosterone, so we can get their levels up in a way that's safe for their fertility, and we don't even have to worry about that red blood cell increase.
And how long have you all been working on this? I mean, how long has it been a question of, we need to look at this more? I mean, people are watching this.
So interestingly, we've been using clomiphene citrate in men for decades. It's an off-label use. So this drug was actually designed for female fertility. Then we learned how well it works in men in increasing testosterone in a way that's fertility preserving. So we've been using that off-label, and it's continued to use off-label, but we have a lot of studies on it over the decades. So the drug itself has been studied for an awfully long time, but the idea of looking at that red blood cell count increase just hadn't been investigated until now. So it's been about a year that we've done this study, and we had patients that had been treated for around a 10-year period that we're able to follow. So we've got nice long-term data on them showing that that's not a big risk and that we can feel relatively comfortable. And honestly, in my practice, I've actually stopped checking red blood cells on the patients on clomiphene because we don't see a rise.
Wow. So when people are watching this right now, how can they go about this process? What do they need to know?
I think the most important thing to know is when a man has low testosterone, is he being treated with the right treatment? And the important thing for all men to know out there is really, if you have low testosterone, make sure that you indicate to your doctor that's treating you whether you still want to have children or not. Because if fertility is still important, we don't want to put that man on testosterone replacement. That's actually the biggest take-home, I would say. We're just getting more evidence of drugs we can use to preserve fertility in a way that we're treating testosterone levels to increase them is more and more safe now.
Wonderful. Well, thank you so much for coming on this morning. We really appreciate your insight on this important topic. And